Hello, welcome you all on today's discussion. Our today's discussion is on adhesive capsulitis. Let us consider the definition of adhesive capsulitis. Before going to formal discussion, let us have a look on the content of this slide. We'll discuss on the definition of adhesive capsulitis and etiology and socio-demographic factor on adhesive capsulitis, then pathology of adhesive capsulitis, then discussion on diagnosis and pathogenic stages, and lastly the management. Let us have a look on definition. Definition: it is the painful shoulder joint with restricted passive and active range of motion at the glenohumeral joint. It is secondary to progressive fibrosis of glenohumeral joint capsule. The exact etiology is unknown, but there are some association on diabetes, certain diseases, diabetes mellitus, thyroid dysfunction, autoimmune diseases, myocardial infarction, Dupuytren's contracture are the common. The socio-demographic factors, the female are affected more than male. Non-dominant hands are affected more than dominant hands. Usually it is affect after 40 years. The peak incidence is within 40 to 60 years of age. Usually happen secondary to some primary pathology like trauma, fracture on and around the shoulder joint, or following a stroke. If you consider the global pathology of the adhesive capsulitis, there is a global capsular inflammation and fibrosis and synovitis. Let us have a look on diagnosis. Diagnosis is based on history, clinical evaluation, radiographs to rule out the alternative pathology, and few cases it may require MRI to rule out the metastatic deposit from lung malignancy. Differential diagnoses are rotator cuff tear, calcific tendinitis, missed old dislocation of the shoulder, osteoarthritis, and other form of tendinitis. If you consider the pathological stages, there are four stages. Stage 1, stage of inflammation. Stage 2, stage of freezing. Stage 3, stage of maturation. And stage 4, the stage of chronic inflammation. Then management. Stage 1 and 2, management is little bit easier than advanced stage. Counseling is very important regarding the disease, and mild to moderate analgesic, muscle relaxant, local analgesic applications with hot fomentation and exercises to ensure the full range of movement of the shoulder, and physiotherapy. And you have to keep in mind the management of associated condition is prerequisite. But in case of stage 3 and 4, persistent stretching is required, exercises, shoulder manipulation, Mobilization under anesthesia, arthroscopic capsular release, and synovectomy by operative means are the modalities. The management of associated comorbidities is essential. Thank you for patient hearing.